I just can't help it, guys. The more I watch this video, the angrier I get. Hey guys, my name's Will. This is the Back 40, and let's talk about it.
We do not have unlimited money in the United States. You do not get free health care. You do not get free health care.
That's Representative Mike Flood from Nebraska telling the good folks in his district, America doesn't have an unlimited supply of money, and you don't get free health care. The first thing I want to do is talk about the services that Mike Flood and his Republican compatriots cut in order to give a tax cut to the rich, which I'm going to talk about in a minute. First, they cut Medicaid, and those cuts mean that by 2034, 17 million Americans will lose their health insurance coverage. I don't care what they say. I don't care what they claim at their town halls. All of the data shows, including the data from the Congressional Budget Office, which up until just a couple of months ago, all the congressmen raved was the most reliable source on hand, 17 million people will lose their health insurance by 2034. The cuts also guarantee that up to 3 million people around the country, whether they work or not, will lose their food assistance. The food assistance they need to be able to feed their families in light of the rising cost of housing, fuel, and groceries. In addition to that, it puts a tax hike in place for parents that use daycare. Now, as a single dad with 4 kids going to daycare before and after school, I can tell you that when I became a single dad, the price of daycare was the single biggest financial shock I took in my budget. It ended up costing me more to send my kids to daycare than it did to pay my mortgage. And don't get me started on all the rural hospitals across the country which are going to close. 700 already due to close before these cuts. That number could double or possibly even triple. Oh, and my friends, for all their talk about public safety, the Republicans cut $646 million from the FEMA portion of the budget that battles against violence and terrorism. And while every study and investigation shows, including the ones done by Republicans in the past, mind you, that cybersecurity and the interference in our elections by China and Iran and Russia is one of the key concerns of the security complex in this country, they're cutting $500 million from that as well. And we can't forget that as part of their ongoing attacks against marginalized people, they're cutting over $100 million from public safety on tribal lands across this country. But don't worry, everybody. It's not bad for everyone. If you're in the top 0.1% wealthiest people in this country, on average, you're going to get a $310,000 tax break every year under this new bill. Good for you, bad for us. And I've got to tell you something else. It amazes me to hear a congressman of any stripe or political party, although it's always the Republicans that say it, make the argument that if you're not working, you don't get Medicaid or health care. That's what the program was designed for. How can you not know this as a federally elected official in the United States of America? This program had several goals when it was started. In 1965, when Medicaid was started, the number one goal in the legislation was to provide health insurance for individuals that were financially strapped and couldn't afford insurance through the private insurance companies. The secondary stated goal was to reduce poverty and health inconsistencies in poor populations, many of who were unemployed at the time and couldn't work. I mean, my God, Mike, the program itself was absolutely created to provide insurance benefits to the people you claim shouldn't get it. How do you not know that? And can you serve as a federally elected official overseeing programs like Medicaid when you don't even know why they were started and what the intention of those programs were? And one final thing, Mike. The average person in this country, according to the numbers coming out of your own federal government, pays over $500,000 in taxes over the course of their lifetime. And people that take advantage of the social safety net, like my family did when my dad died when I was young, they're off of the social safety net within 5 years. 90% of them. It works exactly the way it's designed to work, and it has some of the lowest fraud rates of any program in the country, including the private sector. Why don't you know that, Mike? Why do you rail against it? when indeed it's one of the most efficient programs out there. Oh, and Mike, here's another thing. When you're railing against waste and fraud, which I personally think is a good thing, quit going after the people that use Medicaid, because all the studies show that well over 90% of the fraud that's happening out there is happening at the clinic level by the providers that are supposedly providing health care to the people on Medicaid. Why don't you spend more money going after them? Could it be that they're wealthy? Could it be that some of the greatest defenders of this now serve as senators from the state of Florida? Could it be that they donate to the Republican Party because of the wealth structure they exist in? I don't know, Mike. You tell me. The bottom line is this. I don't care if you're a Democrat, a Republican, or an independent, or if you don't give a damn about politics at all. The Medicaid program was intentionally designed, to be able to offer health insurance benefits to people who couldn't afford it, whether they worked or not. And there's money there to make it happen. But we've got to hold the rich accountable to pay their fair share in order for that to happen. We pay ours. We pay ours over the course of our lifetime. Why shouldn't they pay theirs? So give it a rest, Mike. We ain't buying what you're selling. Just take it back to the barn.